Ultrasound scans were first introduced in the medical field in the 1950s, so I'm sure almost everyone is familiar with ultrasound scans, whether you were pregnant or if you had something medically wrong inside of you that needed to be detected. An ultrasound scan is a diagnostic medical procedure that uses high-frequency sound waves to produce images of organs, tissues, and blood flow inside of the body. Ultrasound scans are considered to be safer than x-rays because they use sound waves instead of radiology. There are 4 general areas to where ultrasounds are performed. OB/GYN ultrasounds are probably the most popular amongst people. This involves looking at the fetus inside of a pregnant woman. Cardiology ultrasounds involves looking at the heart. Blood vessel ultrasound involves looking at the blood flow throughout the body. An abdominal ultrasound involves looking at the main organs in the abdominal area, including the liver, gallbladder, pancreas, kidneys, and the bladder. Of course, ultrasounds can be done literally anywhere on the body that needs to be looked inside of. So there are a lot of areas that do not fall under these categories that ultrasounds can still be performed on. Diagnostic medical sonography is a career in which trained individuals perform ultrasound scans on patients. Those trained individuals are known as sonographers. Sonographers work in hospitals, physicians' offices, and medical ultrasound laboratories. However, hospitals are the largest employment for sonographers. This may be because we used to only be able to perform ultrasounds in hospitals, but we are now able to use the technology outside of hospitals. The salary for sonographers can vary depending on your location and the environment that you work in. Working in West Virginia, you can expect to make about $40,000 a year in the beginning of your career. After you have gained a little bit of experience, the median average salary for sonographers is about $55,000 per year. After you have worked in this career for a while and you do well at your job, you can expect to make about $75,000 a year. This salary is always subject to change. If you live in larger cities or larger states, your salary may increase. Also, your boss may give you pay raises, and there are a lot of different factors that will change your salary. So benefits for this job include paid vacation and holidays. You should receive medical insurance for you and your family, and also, there will always be work for sonographers no matter where you go. Sonography is essential to the medical field, and the medical field is essential to human life. So no matter where you go, you should be able to find work. To become a sonographer, you have 2 different options that you may choose. First, you can choose to obtain a Bachelor of Applied Science degree in Diagnostic Medical Sonography, which means you must complete 4 years of schooling in an accredited college, or you may choose to receive an Associates of Applied Science degree in Diagnostic Medical Sonography, which means you must do 2 years of schooling in an accredited college. They are both similar, but generally people with bachelor's degree are considered to be more professional and more trained because they received more education. Sonography clinical experience is the next step into becoming a sonographer. This means that you will follow around a trained sonographer and see the daily task that a sonographer does. This will get you familiar with the work field while having a professional guide you. After you have did this, you must become certified by the American Registry for Diagnostic Medical Sonographers. This means you must take an exam and pass the exam to become certified in the area of your choice. Just because you're certified in a certain area does not necessarily mean that you will only perform ultrasounds in that area. Diagnostic medical sonography is a great career to have and will always be important in the medical field.